Okay, Bismillahirrahmanirrahim. So now we'll see the muscles of the anterior compartment of the thigh. So the main muscle here is the quadriceps femoris. So you should know what are the different muscles of the quadriceps femoris. We have one rectus femoris that we have already talked about, and then we have three vasti: vastus medialis, intermedius, and lateral femoris. Now, you can see that this muscle. Let's talk about the quadriceps femoris first. So this one is the rectus femoris, and on the lateral side we have the vastus lateralis, and on the medial side we have the vastus medialis, and deep to rectus femoris you can see there is a muscle which is the vastus intermedius. To see the vastus intermedius, we have to remove the rectus femoris. So in this model you can see that the rectus femoris is removed, and then now you can see the vastus intermedius. So again, what are the different muscles? We have vastus medialis, which is on the medial side, then we have vastus intermedius, and then we have the vastus lateralis, and above the vastus intermedius you will see that this is the rectus femoris. So again, this muscle is very important here. This is important because it is one of the main support for the knee joint, and also because we use this for the knee reflex also. So what you have to know, you have to identify these muscles and then action, nerve supply, all these are the theoretical part here, but for the practical purpose you have to identify the different muscles of the quadriceps femoris. So again, vastus medialis, vastus intermedius, which is deep to the rectus femoris, so this is the rectus femoris, and vastus lateralis. So three vasti with one rectus femoris. In this model again, you can see, you can identify the rectus femoris. As I told you in the beginning that we have two anterior superior and anterior inferior spine. From anterior superior we have another muscle taking origin, that is the sartorius. So you can easily identify sartorius here, which is cut, and deep to sartorius, from the anterior inferior iliac spine this muscle is coming, and which is the rectus femoris. So this is the different component of the quadriceps femoris. Now what are the other anterior muscle here? One is the sartorius muscle. Sartorius, the origin is from anterior superior iliac spine, and the insertion is over here, where upper medial shaft of the tibia. One of the muscles is the sartorius. This is the longest muscle here. Okay, now what are the other muscles? Apart from this, we have this muscle which is coming from the anteromedial surface of the iliac. So this big muscle is the iliacus, and then we have another muscle here which is coming from the posterior abdominal wall, and that is the psoas major muscle. So iliacus and medial to the iliacus is the psoas major. They are joined together and they get attached together, and that is on the lesser trochanter. That is on the lesser trochanter of the femur. So remember that these two muscles are named together, iliacus and psoas, as iliopsoas. They get attached to the lesser trochanter of the femur, and the main function is the flexion of the hip joint. So remember this about this muscle. Then we have another muscle which is taking origin from the superior ramus of the pubis, and then it's going to the anterior compartment. This we call as the pectineus. So again, this is important here. So you can see the muscle from lateral to medial. One is the iliacus, then we have the psoas, and then we have the pectineus muscle. And these muscles are also forming the floor of this triangle. You can see there is a triangular area forming anterior to the thigh. This we call as the femoral triangle. Again, the femoral triangle is important. What you have to know? You have to know the border of the triangle. This is the base, which is formed by the inguinal ligament from anterior superior iliac spine to the pubic tubercle. So this is inguinal ligament here, and then we have the laterally formed by the sartorius, medially formed by the adductor longus, and the apex is formed where these two muscles, the sartorius along with the adductor longus, is coming. Now from the apex we have another canal that we used to call as the adductor canal. So you have to identify the adductor canal again here. So this is the adductor canal which is starting from the apex of the femoral triangle. So how it is formed? Superiorly it is by the sartorius muscle, then laterally it is by this muscle. So what is this muscle? This is vastus medialis. So it is forming the lateral boundary or the lateral wall of the adductor, and similarly we have here the adductor longus and the magnus, which is forming the medial wall. So this is the adductor canal starting from the apex of the femoral triangle. So two important structure here is, one is the femoral triangle and then another is the adductor canal. So again, these are very important topic. You have to know everything about these two triangles, how this femoral triangle is formed, how is the adductor canal is formed, what are the content of the femoral triangle, and what structure passes through the adductor canal. So these are the theoretical part, you have to know about it. This is important.